Hey, I'm Jim, and I'm videoing for Miss Bell.
Audience, please. A 5. Thank you very much. Hi, everyone. My name is Valerie. Thank you for coming to listen to my speech. I promise it to be quick and painless and refreshments afterwards. So, the following speech has a lot of meaning to me because my son has recently been diagnosed with ankle problems. The quote: I have a healthy lifestyle, but there's nothing that you can do to prevent from rolling an ankle or something like that. Unquote. Sean Michelle Johnson is an American retired artistic gymnast. She's the 2008 Olympic balance beam gold medalist and team all-around floor exercise silver medalist. She quoted that statement after an injury to her own ankle. According to the National Institutes of Health, ankle sprains are one of the most prevalent injuries of the musculoskeletal system. Researchers have estimated that one ankle sprain occurs per 10,000 people each day. It's a lot of people. The most common mechanism of injury is an inversion of the plantar flexed foot, also known as a sprained ankle. Inversion injuries involve about 25% of all injuries of the musculoskeletal system, which affects more than 20,000 patients in the United States each day. About 50% of these injuries are sport related. Some sports, basketball, soccer, and volleyball, have a particularly high incidence of ankle injuries. If not treated properly, inversion injuries of the ankle can result in persistent problems in 30 to 40% of patients. And would you know what to do in the event of a minor sprain? Use the rice method. No, it's not brown rice, it's not white rice, and it's not any flavored rice. Rice is a mnemonic for 4 elements of treatment for soft tissue injuries. It's an acronym meaning rest, ice, compression, and elevation in an injury that you know is not severe enough to warrant emergency medical treatment. The rice method. First off, I like to begin by giving you a brief overview of rice. Rice is to be used for sprain or bruise therapy, starting with rest. Rest is the first very important step. You should stop all physical activity and rest as soon as the injury occurs. Continued exercise or other activity could cause further injury, delay healing, increase pain, or stimulate bleeding. Avoid bearing weight on the injury with the use of crutches for an injury to the ankle, foot, knee, or leg. If it is an arm, hand, wrist, or elbow injury, sprain, the use of a sling is recommended. It reminds me of a time when my mom had injured her ankle and we all posted definitions of the word rest to my mom's Facebook page. We each gave her a different definition because she is so active and because we know how she is. She's the type who never sits down, so it was really funny because the post multiplied and people commented. So as she was resting, she was able to read the posts and it just cheered her up as she was healing. Now, leading into the next letter, rice, I. I stands for ice. Ice helps stop further swelling and bleeding for injuries to small areas such as a finger, hand, wrist, toe, or foot. Immerse the injury for 15 to 35 minutes in a bucket of ice, a slushy consistency. For injuries to larger areas, use ice packs. Avoid placing the ice directly on the skin. Before applying the ice, secure a cloth, pillowcase, or towel to the injured area and use an elasticized compressive bandage or an ice bandage. Ice the injured area for 20 minutes and then take off for 20 minutes. Repeat 20 on, 20 off cycles for up to 3 hours. If pain and swelling persist after 3 hours, you should contact your doctor. Regular ice treatment is often discontinued after 24 to 48 hours. Now, a bag of frozen vegetables really works wonders when you're out of an ice bag or an ice pack. I personally recommend the peas. So who would have thought that is pretty brilliant? Yes, it sounds a little odd, but it does work in a pinch. The third letter in rice is C. C stands for compression. Apply Compression to the injury using an ACE bandage. Be careful not to compress the area so tightly that circulation is cut off. Signs of the bandage is too tight include numbness, pain, cramping, and a bluish tint to the skin. Remove the bandage if these symptoms appear. Remember, blue color is not good. And lastly, the letter E. E stands for elevation. Elevation to the injured part of the body above the level of the heart is another way to decrease swelling and pain at the injury site. Elevate the injured area which has been wrapped in ice or whatever way is most convenient. Prop an injured leg on a solid object or pillow. Elevate an injured arm by lying down and placing pillows under the arm. Folded towels and blankets. They can get the injured area up higher than your heart. So if you can remember rice and you have a mild sprain, you will easily be able to remember RICE and be able to treat the sprain with the rice therapy. Keep in mind that this is only a suggested treatment for mild soft tissue sprains and bruises, and more severe injuries should always seek immediate and medical care. RICE, rice. Thank you.